Remember silly statements like, we fight them over there so we don't have to. Welcome to Politics Done Right. I am your host, Egberto Willies. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at EGBERTOWILLIES. That is at Egberto Willies. Let us engage. It is Politics Done Right. Well, folks, welcome to one more edition of Politics Done Right. I'm Egberto Willies, your host. Thank you so kindly for being a part of the show. We are going to have a great show for you today, but since, we missed on getting that interview out yesterday, I'm going to try to start it early today, but let's first get busy with welcoming folks aboard. Welcome aboard, Brige MCP. Welcome aboard, AVQ. Welcome aboard, everybody that's here. Brige says, hey, peeps. Michael says, here we go again. I am over, and more people are in but not reporting. That's okay. Please remember, though, if you are on YouTube, go ahead and give us that thumbs up. If you are on Facebook, go ahead and give us that like. Bree says, hi, everyone. How is this TN child marriage law going to help this? The legislation is designed to legalize common law marriage in Tennessee as a way to push back against the LGBTQ movement. Makes no sense. This is a whole, these guys are pedophiles. They always accuse the Democrats of being pedophiles, but somehow they're always convicted of doing that. There's a piece that I'm going to kind of cut out from Chris Hayes yesterday. I was supposed to do it. I failed to do it. Now that you brought that up, I remember that it was something I was planning on doing last night. Anyhow, Michael Rudnin says, Tennessee GOP bill eliminated age requirements for marriage. The HB 233 bill would establish common law marriage between one man, one woman, but it does not include a minimum age requirement. Opponents of the bill said it could open the possibility of child marriages. The current age for marriage in the state is 17. I really hope this is a bug, not a feature, end result of their culture war nonsense. If Republican is answer to homophobia is pedophilia, we are going to even more problems than we already have. And yes, we know that they are famous for those instances of pedophilia. So folks, yeah, it would not surprise me at all, folks. It would not surprise me at all. It would be true to form. Again, it would be true to form. Continuing, proposed legislation could legalize child marriage in Tennessee. 24 Tennessee Republicans are sponsoring this legislation, and right now it's making headlines around the world. Newsweek, The Hill, the Daily Mail in the UK have all written about it. Twitter is all abuzz about it, and all eyes are on volunteer state as people wonder if the state's lawmakers are about to legalize child marriage. Yes, they are. They party of QAnon and family values who believe Democrats are satanic pedophiles attempt to pass a law that effectively legalizes child marriage. I know they are. Listen, everything that they speak negative of somebody else is something that they actually see in the mirror. The party of family values so far are a progressive-led Democratic Party. Not even good old Democrats in general, because we can look at Manchin. Manchin is not somebody that supports the family. He can't support the family if he won't give them the $300 or so that they need for support. So let's be clear on that. It's no family values people at all either. Continuing, Oklahoma House passed near total abortion ban with threat of prison for providers. These harmful bills are an alarming reminder that the days of access to safe and legal abortions may be numbered, and we must continue to fight to guarantee all people have access to the essential health care they need, including abortions. Tamia Cox Tour, director of American Civil Liberties Unions of Oklahoma, 10 years in prison and ensuring women lose bodily autonomy. It's a shame Republicans would turn women into second-class citizens that they typically do. All right, continuing. We have no obituary for Earth. Scientists fight climate doom talk. Scientists spend decades rallying on the public to fight climate change. Now they must also combat hopelessness. No, never be hopeless, never. Climate change is going to get worse, but as gloomy as the latest scientific reports are, including today's report of the United Nations, scientists after scientists stress that curbing global warming is not hopeless. The science says it is not game over for the planet Earth or humanity. Action can prevent some of the worst If done soon, if climate change was caused solely by other nations, we'd have long since seen global warming as a national security issue, an existential threat, and treated in such. However, climate change is a large part compounded problem of our own making. Again, people complain about, well, all these other third world countries or other countries, they're not going to change. They're not going to do anything to stop their burning, etc. What we forget is all of that carbon, that excess carbon in the air was put by the industrialized nations. And then we ask, and we got ahead as industrialized nations by throwing all that carbon up into the air. Other countries that want to get ahead, we're telling them, no, you can't throw this stuff in the air, baby. You can't throw this stuff in the air. And they say, okay, we won't. Pay us. You got your wealth off of polluting something that affects us all. Pay us for the damage you've done, since you don't want us to do further damage. We don't want to do further damage. It's that simple. But you don't hear that in our mainstream media that says, well, whenever somebody says that, well, India is going to continue burning, well, India didn't have the amount, they didn't throw what we threw, neither in absolute terms or per capita terms. So there you go. Sanders pushes for a 95% tax on corporate windfall profits. Sanders highlighted reports detailing higher profits made by companies like ExxonMobil and Tyson Foods during the pandemic. It's appropriate that during the pandemic, during the war in Ukraine, during all the instability, that it's the moment in which large corporations continue to enjoy huge profits? No, Sanders said in opposing remarks during a budget committee hearing. Again, these guys are profiting from our pain, from our damage. Of course, we should tax all the excess out of there. I don't even think we can say, you want to see how prices go down? Tax all of it. In other words, 99% tax on it. Watch how quickly inflation drops, because there's no incentive there to have these price hikes, right? And people say, oh, well, they'll stop innovating. They don't innovate anyway. They don't innovate, and we spoke about that yesterday, and we'll continue to speak about that. Okay, what we got here? Paul Fleming says, ATL checking in. Welcome, Paul. Hit that like button. Listen to Paul. Hit that like button. Bridge MCP says, hola, Paul. Carl Cox is here. He says, conservatives want to back the way America was in 1776. Oh my God, please don't, please don't. Alistair Waters, my sister from Texas. Greetings from sunny Conroe, Texas. Alistair, when I get back to Texas, we need to get the Texas posse together in some central location, like maybe in the woodlands somewhere, or maybe, I don't know, if we have some of the folks from South Texas, maybe we'll meet somewhere in the Galleria area or something, get some coffee and get some videos made and play it on here and say, we are part of the Texas PDR posse. And we do the same thing when I go visit New York. I should be visiting Pennsylvania for the what is it again? Netroots Nation. Anyhow, continuing. We got Michael Ronin said, Egberto, I hope you watched the Curses in a Nutshell video as a follow-up after the show. It's about not succumbing to hopelessness while offering some good news about properly addressing global warming. You're a good man, Redden. I'll make sure to note that. Tom C says, Yahoo News, percent study, Republican-controlled states have higher murder rates than Democratic ones. Murder rates in 25 states Trump carried in 2020 are 40% higher than the states in Biden. Hey, Tom, I don't want to forget. Could you please not put it here, but email me a link to that story to info@politicsdoneright.com, info@politicsdoneright.com. Please do. Yeah, Alistair, yeah, we are going to, I'll be back in Texas in the next few months. I want to meet those are the Texas folks that we can meet here. And by the way, if any of you guys are here in DC or the DC area, my daughter is kind of, I think she's tired of seeing me in the house. She wouldn't mind if I leave the house a couple of times. We can also get together and say, hey, welcome aboard, get some pictures, put it up here, let everybody be happy. Michael said, Egberto, I'll message you the link over Facebook Messenger. Good enough? That is great. Thank you so kindly, Senor Rudnin. All right, folks, I'm going to go ahead and get started with the video because I want to get it out. And it's a good video. But I want to qualify something here. And because some of you are going to be upset with me. And let me tell you why you're going to be upset. Because this guy he's a good guy, but he isn't a Medicare for all guy. When people come and I do interviews with people, they are my guests. My goal with getting people of all sorts on my show is not for gotcha moments. It's to hear their point of view and be frank with my point of view, but at the same time, make them feel comfortable enough so that we can see how others think. This guy's a good guy, but again, he doesn't necessarily believe that Medicare for all is a possibility. All of us here know that it's not a possibility unless we work hard for it, and that is what we intend to do. So let's go ahead without further ado and bring you Mr. Wilcox and Dr. Wilcox, and we'll do that right, David Wilcox, right now. Welcome to one more edition of Politics Done Right. I'm Egberto Willis, your host. Thank you so kindly for being a part of the show. We are going to have a great show for you today. Dr. Wilcox, Dr. David Wilcox, is a doctorate prepared nurse who also holds a master's in health administration and is board certified in nurse and informatics. Dr. Wilcox has 28 years of healthcare experience in which he worked as a bedside nurse, hospital administrator, and in healthcare information technology, which has helped him to develop his unique perspective on the American healthcare system. Dr. Wilcox is the author of the book, How to Avoid Being a Victim of the American Healthcare System, a Patient's Handbook for Survival. Dr. Wilcox, welcome to Politics Done Right.
Thank you. I'm glad to be here. Thank you for having me today. And let's talk about the American healthcare system.
Well, you know, I have a lot to say, but it's, you know, today's you, brother. Today is you. I want to hear what you have to say, because one of the things I like to do whenever we're talking about something as healthcare is to learn what other people think, what other ideas people have, because that is the only way we're going to ultimately come out with the right solution. And the title of your book is intriguing. So let's go ahead first. Tell us a little bit about yourself before we get started.
Sure. So I have a special needs daughter that I took care of many years ago. And that is why I became a nurse in the first place. So I'm kind of like a homegrown nurse. I started out as a licensed practical nurse. Then I went back and got my degrees, and I became an overachiever and finally landed with my doctorate in nursing. But I remember the caregivers that took care of my daughter. And I thought, when I was working in manufacturing, when I got laid off, I had tuition benefits. And I thought, you know, I want to get into healthcare. I want to do something that really matters. I don't want to be making plastic parts. You know, I want to do something that really matters. And so that's what I did.
Now, well, that is great. Now, you said that you had a daughter that needed quite a bit of attention, quite a bit of healthcare. How did you find interfacing with the healthcare system, whether it's I imagine if she was probably on disability insurance, or was she on private insurance?
No, she was on disability insurance. Yep.
Right. Well, I imagine then, well, that was a lot. How did you find interfacing with the insurance?
Oh, the insurance was tough. It was tough to get it. And because it was Medicaid, once we got it, they pretty much covered a lot of stuff.
So, are you in Texas?
No, I was in New York State at the time.
Gotcha.
Now I live outside of Charlotte, North Carolina.
Okay.
But yes, it was crazy. Back then, you're talking back 30 years ago. So, right. I mean, it was a whole different story than what it is now with the insurance companies. So we didn't have the Obamacare. Insurance companies could hand select people, right? And say, you don't get insurance because you've got a pre-existing condition. Or if you want insurance, you've got to pay through the roof to be able to get it because you have a pre-existing condition. They weren't doing that back then.
Well, amazing. Anyhow, so you wrote this book, How to Avoid Being a Victim of American Healthcare System. The fact of the matter is most people are, in fact, victims of this, what I call wealth transfer engine. So why don't you start telling me a little bit about why you wrote the book and some of the techniques that you found helpful to people based on your experience?
Sure. So, the reason why I wrote the book was I was finishing up my doctorate degree, and I thought to myself, what do I want to do with all this information that I have? I definitely didn't want my boss's job. I didn't want her boss's job. So, I thought, what am I going to do? And then the thought came to me, why don't you break down the complexities? Because healthcare is complex for a reason. It's complex because the entities that are buying for your healthcare dollars, my healthcare dollars, they don't really want you to know what's going on underneath the sheets, under the blankets in healthcare. So I thought, why don't I just break that down and write a book and explain to the American people in layperson's terms how to navigate, how to stay safe in a hospital. What do you do when you get that insurance company letter that says you're denied, your claim was denied? What do you do when you go to the pharmacy and find out your prescription drug medication is going to cost you your entire week's grocery budget? What are some of those tips and tricks? How do you navigate it? So that's why I wrote the book. And, you know, it's interesting because of the feedback that I've been getting from people who have actually read it. So I have a neighbor who was going for surgery, and he told me, he said he went in to talk to the surgeon after reading the chapter on what do you ask a surgeon? And when he went in, he said to the doctor, he said, okay, so I have a couple questions for you. And he said, shoot. And he said, first of all, you're going to be the one doing the surgery, because a lot of people don't know in teaching hospitals. So you're paying a surgeon to do it, but it's an intern or a resident doing your surgery, right? And you have no idea that that's going on. So the first question is, are you going to do my surgery? The second one is, am I going to be your first case of the day? Because statistically, you'll do better if you're the first case of the day when the surgeon comes in refreshed, as long as he hasn't been on call the night before. And that's what you want to ask him. Are you on call the night before? So he had a whole laundry list of questions to ask this guy. And he said when he got done, surgeon looked at him and said, I don't know who you're talking to, but those were some great questions. And so he came back and told me, he said, you know, this was my experience at the surgeon's office, and thank you for writing that book. So, and there's all kinds of tips, like looking at your hospital for star ratings. So you can go out to the Centers of Medicare and Medicaid Services, and you can actually see what your local hospital star rating is on 1 to 5, 1 being the worst, 5 being the best. And I would recommend that you don't, if you have the choice, don't go to a hospital that's less than 4 stars. You can also rate your doctor. You can also find out what his star ratings are. You can ask who your anesthesiologist is going to be and check out their star rating. So there's a lot of tips and tricks in this book that the general public really doesn't know. Oh, I lost.
Let me go ahead and ask you it this way. So we don't want you to give away, but because I mean, first of all, we couldn't cover that in 20 minutes. But what are the what can I expect to get out of your book other than let's say talk to your surgeon, shop around for a hospital, look about ratings? Are you going to walk folks through how to do that? Because I'm going to tell you something. It is not. First of all, you have a great book, and for those who are going to, you know, sometimes you have to know what you don't know and learn how to get to know it. And both of them requires a certain amount of skill. And I imagine one of the reasons that you are here as well is to point to people, hey, there is knowledge out there for you to use. That's knowledge correct. Out there for you to get, because most people don't know it. How else can you hold their hands to say, get my book for this additional reason?
Sure. So there's a couple things that come to mind. One is a website called healthcarebluebook.com. So if you call your hospital or go on our website to find out what a total knee is going to cost, more often than not, even though there's legislation that's been in place since January 1 of 2020, they're supposed to give you the pricing, but if you go out there, it's usually a medical code. And I mean, I did it at my local hospital. I would have needed a medical coder, and I'm a doctor, prepared nurse. So healthcare or bluebook.com, healthcarebluebook.com will actually price out what a total knee will cost in your area. Then you'll learn things like, if you're in good shape, like we are, you can go to an ambulatory surgical center and get that operation done for about $8,000 in my area. But if you go to a hospital, it's going to cost you $12,000. So if you have so if you have a very high deductible, you really want to pay attention to that, right? You want to make sure that you're getting pricing, because the hospital's not really going to be as transparent as they should be with you. And I could go on for days about, you know, when do you pick up a loaf of bread at the store, go to the register and find out it's going to cost you $20 after you've eaten half of it, right? Because that's what healthcare, that's the model of healthcare. The other thing that people really need to understand about healthcare is it's fundamentally flawed. So in the fee-for-service system, which is what we have right now, the doctor gets...
Explain what that means, because, you know, that's a term that people use all the time, but I don't think people quite understand. You know, I'm an engineer, right? And if our bridge falls, we pay a penalty for it. If we don't provide a service or something, but that's not how the healthcare system works. If you go in there and you die, you still owe the bill, and your estate pays it.
Yeah, that's right. So fee for service is basically they get paid on volume. They get paid on the amount of patients they see. So have you ever gone to the doctor's office? He spends like maybe 5 minutes with you, turns you back over to the nurse to ask questions, and then he's off because he's getting paid. And I could break it all into medical terms, but we won't do that. He's getting paid on how many people he sees during the day. Same thing in emergency department or at the hospital. So if you show up and you're sick, you're making them money. So what we saw during COVID, when people had elective surgeries such as total knees or things like that, they didn't go to the hospital. So what happened? We, the taxpayers, had to bail them out to keep the doors open, right? So this fee-for-service system is incentivized. It's incentivized to make more money for the providers and the hospitals. What people don't know, or only 25% of Americans really know about this, is there is a new model out there called value-based care. Value-based care gets paid on outcomes, on how well the patient does, as opposed to walking in and being sick and being treated retroactively for an illness that you have. Value-based care means that the insurance company is going to pay a certain amount for me, and my doctor is supposed to keep me healthy and out of the hospital. And if he does, he gets to keep the profit, as opposed to showing up sick and then making a lot of money off of me. So I get incentivized. They do things like they track my steps, you know, my tracker here. I can monitor my food intake if I want to, but they're incentivized. They're going to push out notifications to me. You need to come in and get your flu shot. You know, you need to get your colonoscopy. Yeah, because if something goes wrong with me, then they're on the hook for the rest of the money. And that is going to fix healthcare in this country if we can just move the legislators out of the way so that we can do this. It's already during COVID, we saved $4.1 billion in the value-based care system because they got paid whether you showed up or not. It was a capitated model. They got paid whether you showed up or not. Fee for service, we were bailing them out left and right, with taxpayer dollars, keep the doors open. So that's one of the things you're going to understand. And the other piece of it is how to use technology in that situation. So if somebody has congestive heart failure, which means your heart doesn't pump enough blood, and they're at home, usually what happens is the person, they don't walk as many steps. They're a little short of breath, don't really feel right. Maybe I'm coming down with a cold, I don't know. And then by the time it becomes a full-blown crisis, they're in the emergency department, which is a big old money generator for the hospital and for the doctors. And you don't get the benefit of having the proactive care. What happens in value-based care is your tracker goes up to a cloud. You have a wireless blood pressure cuff, right? You have a wireless scale so they can see if you're gaining weight. And then that all gets fed up and it bubbles up to the top of somebody's list, usually a nurse navigator position, who comes back and says, oh, Mr. Wilcox, Dr. Wilcox, you need to come in and see us, or we're going to adjust your Lasix. It looks like you're not walking as much anymore. Your oxygen saturation rates are down. And so they're incentivized, right, to keep me from going into that full-blown crisis in the emergency department. So it's a win-win. It's better quality of care for the patient. It's increased awareness for the physician group. They're incentivized to keep you healthy. So it's really quite amazing that what this value-based care model is doing for us.
No, I think that would be orders of magnitude better than what we have today. What makes you believe, however, that the way our corporatocracy runs, that they will find any reason to want to have a system of that sort?
Well, there's already systems of that sort out there, and there's data that shows that they work. In fact, in just the recent $5.1 billion, or was it trillion or billion dollar bill that just went out, there was they wanted to put a value-based care act into that to incentivize more clinicians to do it, because I mean, your clinicians are going at risk. They're not used to that. They're used to getting paid when you show up. So all of a sudden, if they have to keep you healthy and they get a certain locked-in amount, they want to know that they can keep you in their network, right? They don't want you to go outside of their network where it's going to cost them more money. And in network means you're going to go see the doctors that are all underneath this plan, because it's a group of doctors who share that capitated amount. So their little they're a little afraid to make that jump into value-based care, but the doctors who are doing it and doing it correctly have the data to show it can be done. But they didn't improve that act in that bill. So
Now,
we were hoping they would.
you are ingrained into the current system, and I see the absolute value in your book in how can you navigate the current system as is, which I think it's essential, right? Unfortunately, for most people who are not going to get your book, for most people who don't know what they don't know, and most Americans throw their hands up in the air and say, look at what they're charging me. Look at what they're doing for gasoline. Gasoline is $5 and a gallon, even though we have a surplus of oil that nobody talks about. It's like quiet. Venezuela is swimming on oil and we just don't allow them to pump. We can do a whole lot of things. Like we can talk so most Americans don't know things. Now I want to challenge you, however, in one respect, and that is, I understand that you are a creature of the system, which is and that you are able to tell us how to navigate it successfully. You've also told us about a value system that I much prefer, and I think it's more humane. In other words, it actually says to you, hey, go ahead and we treat the whole body and make sure you don't get sick. That's a great thing. I want to challenge you in one respect. That still has that profit motive in there that, to me, and you can correct me if I'm wrong, still says that there's a potential that I may not want you in my group because you may actually skew the numbers if you have that, even within that value-based system.
Sure.
That's what I see I see the value system as humane, but I also see that given that it has a profit motive, and there's nothing wrong with a profit, but in healthcare, I really cannot fathom having the motive in there. Convince me that I'm wrong.
So let's explore that a little bit. So other countries, now we went up from 17.6 of our GDP to 19.7 in 2020. Most countries pay about 8.7 of their GDP. As far as healthcare quality outcomes, we are dead last in industrialized.
OECD, yeah.
Yes. So they're doing some things that are working. It's not perfect, right? Within the government being able to negotiate prices, okay? So they can negotiate, if they're taking in a bunch of low pressure or a drug, they can negotiate it for the entire population of, let's say, Finland. They can negotiate that price. With Medicare, we're not allowed to negotiate the price.
Exactly.
Right. There's a bill in place that says you can't negotiate it. Now they're doing some work on that. Hopefully we can negotiate drugs that meet a certain criteria, like greater than 5 years old. But that's crazy, right? So we have this unregulated pharmaceutical company, and everybody thinks they make big money off these brand name drugs when they come out of the gate and charge way too much for them. It's the ones they're not talking about. The curve goes up over inflation, and that's how they're pocketing the money. And they're making their shareholders 15 to 25% a quarter, right? So yeah, the profit margin. So this country will never, and this is my opinion, will never go to socialized medicine. It just won't happen.
Let me stop you there and ask you a question though. You've been in the system, and you don't have to answer that, but isn't that model really the most efficient model of them all?
It depends. So there are some efficiencies that are gained, such as price negotiation. But you see what happens in Canada, right? Canada, it's hard to get an appointment. All the doctors leave during the summer because they can, and so you'll get the junior players there. There are some aspects of it that work right and some that don't. But the closest thing that we're ever going to get to, I think, is going to be an incentivized model in which the actual physicians, the respiratory therapists, the dietitians, the nurses, they all have skin in the game and get paid to keep you healthy. I think that's the model that we're going to see. This value-based care model is the model. And I know you alluded to the fact that you don't like the profit aspect of it.
Yeah, I'm going to go into that a little bit more later. But I mean, yeah, I don't. Sure. I don't think it's moral. But please finish for me.
Yeah. So, but if you're working to get your profit, because in a fee for service, you're not, you're seeing them come in, you're making your notes, you're getting paid, the coders are going through, pulling stuff out. That's a whole nother nightmare. And that's another thing they gain in socialized medicine. Like they might have 7 coders for the entire country of Canada. We probably have like 350,000 here in the States. So that increased the cost, right? So they're actually working. My point is they're working for that money because they're part of your healthcare team. You are partnering with them as opposed to being treated by them. There's a big difference when I partner with my providers as opposed to being treated. So then I have some accountability. If I'm going to go to Wendy's every day and get a burger for lunch, or if I'm going to go to Whole Foods and get a salad, I have the accountability with my provider. It's not just I get sick and then I go to the hospital and they fix me up and then I go back out and live my current lifestyle and get sick again.
Dr. Wilcox, let me say it this way. You wrote a book on how to navigate the current system. You're earning your money legitimately in giving a worthwhile service. The system exists today as it exists. And as it exists today, we need somebody to tell us or help us navigate the system. You are worthy. You are worthy.
Well, thank you. I appreciate that.
Let me finish. But you are worthy. Okay. What the part that I don't understand with somebody like yourself and others that I've spoken to on this issue, I think this sort of a profit motive within the healthcare system, or I guess it's the kind of economy that we have in the United States, is so inculcated in our minds that we don't see sometimes the other side. And I want to query you and just ask you a couple of things. And you work so hard to navigate this system. The shareholders who hold the hospitals, the shareholders who hold the doctors hostage, all these guys, they're not like you, doctor.
No, they're not.
Okay, and that is a profit motive that I'm talking about. Also, you spoke about, the doctors are incentivized. Yeah, they get a good salary, and I want them to get a good salary. My sister's a doctor. My daughter, who just had 2 strokes, is working on her boards right now to be a doctor. I mean, so I am all for that. I just want or hope that we will see more people of your caliber, because you know how the system works. Tell people like it is, like, hey, those shareholders didn't do a damn thing for,
That's right.
most drugs are developed at universities or grants that are given from the NIH, and when their viability shows up, then the shareholders come in and say, oh yeah, we'll invest in that now because we see the viability.
Right.
Those are the kinds of things I want to mitigate, but I think it's people like you that have to. I mean, I think you can do a better job than I can in putting that message out.
Yes, definitely. So in the healthcare realm, we're called disruptors because we're not going to sit back and watch this happen anymore. So have you followed Mark Cuban's generic pharmaceutical online company at all?
No, I have not.
Okay, so this is a guy from Shark Tank, right?
I know who he is, yeah.
Okay, so he started an online generic pharmaceutical company to lower costs by huge amounts. Because what people don't know is, you think a doctor writes you a prescription, you go get it filled, and it's a transaction between the doctor, yourself, and the pharmacist, right?
There's that middleman, PMBs.
Yes, pharmacy benefit managers. So what Mark Cuban has done is he said, I'm not playing with the pharmacy benefit managers. I'm not going to support that role because they will charge you the price of admission to the insurance companies. And so what he does is he goes directly to the drug manufacturer, buys the drug for as cheap as he can, sells it for a 15% markup to keep his business sustainable. And he said he could make so much more money if he just played ball with these guys, but that's not what it's about. So, and then there's like another 5% or something to ship it to you. But that kind of disruption makes the pharmaceutical companies,
I didn't know about that. I didn't know about that at all. I'm going to look that up because, and see, and anybody can use his services.
Yes, as long as you have a prescription called in, and he's got a warehouse actually in Texas. So he's got a warehouse.
Well, he's from Dallas, yeah.
Yeah, so he plans on expanding this model. So, why would you, I mean, it's cheaper than having insurance, which makes you start to wonder, Medicare Part D, do I really need it if I can get my drugs at, dirt cheap from his site? So it has a tendency to rock the boat in so many directions. I mean,
Right.
GoodRx was one of the initial ones that did it. But he's just doing it to help people. And that's what we need more of. We need more care in healthcare. We don't, healthcare has become, like you said, a business. It's profit driven. They've got shareholders. They've got to make a certain amount of money. But what happened to the care? What happens to the poor guy that goes into the emergency department? He has congestive heart failure. He gets his prescriptions. He goes to the pharmacy and he tries to fill them, and they tell him it's going to be $250. He opens his wallet and he's got a 20, right? He can't get those drugs. So he leaves and he goes back because they fixed him at the hospital, and he gets sick again within the next 30 days or so. And he's right back in the emergency department, and it's a vicious cycle. I've even heard of a pilot program where, because hospitals started to get dinged, we talk about profit, because if somebody had been there within 30 days and came back for the same condition, they weren't going to get paid for it for certain conditions. They just gave people 30 days worth of medication because it was cheaper to just give them the drugs, right? And then they don't come back, and then the hospital doesn't get dinged. So yeah, unfortunately, it really does come down to the money motivation. I mean, we could talk about one of the big healthcare insurers that's actually insuring the Medicaid population in Arizona. Went out, they found the people that were costing them greater than $50,000 a year in costs, bought an apartment complex for these homeless individuals and said, hey, we will give you an apartment. We'll give you access to a nurse practitioner for 4 hours a day. You have to stay out of the hospital, quit going to the ED, quit becoming an inpatient, and we will take care of you. And if you can do that, we'll help you get signed up for SSI. And so they returned investment to their shareholders in a very humane way, but it was all driven by the dollars, because the guy who was doing the right thing and not accessing the system, he didn't get any of that benefit, right? Nothing. So.
Well, let me tell you, Dr. Wilcox, my last question always say, where have I erred? What would you have liked me to ask you? Well, I want to do this, but beforehand, I want to do a 1 minute monologue and say, first of all, thank you for appearing on the show. Thank you for writing the book, because I think that people have to learn how to navigate the system as it is today, not necessarily how an idealist like me would want it to be, or a more pragmatic person like you would want it to be. You have to be able to look at the system the way it is today. So I thank you for the book. I have one request for you in the future, given that you know the ins and outs of how the system works, that you consider some of the ways that I think that says, let's get the damn profit from shareholders and all those crazy bonuses out of the system. How maybe write a book on how can we transition to that. So that's my 1 minute spill with you. But please, sir, what didn't I ask you that you would have liked me to ask you?
Sure. So the one thing I would like everybody to hear is, don't access the healthcare system without knowing about the healthcare system. You'll get hurt. Happens all the time. I've seen it happen all the time. We have a nurse from Vanderbilt that's just recently went to trial for a med error. I mean, it's the first time we've seen a nurse do that before. And we could definitely do a show on that, because that's crazy. But my point is, proactively educate yourself with viable, good materials. And that's why I wrote this book, was so that people could proactively educate themselves, so they knew how to behave in a healthcare system and how to partner in their care. For instance, if somebody rushes in to give you meds, you make sure they tell you what each medication does and cross-references with what you take at home, because people have gotten hurt in rushed medication scenarios. So do your research. Just please do your research so that you can be safe, and we can have a beer together someday.
Dr. David Wilcox, author of the book, How to Avoid Being a Victim of the American Healthcare System, a Patient's Handbook for Survival. Thank you so kindly for having been on Politics Done Right.
Thank you. Thank you for having me. I appreciate it.
All right, folks, I hope you enjoyed that. Let me go ahead and answer your questions real quick, because but the first one that I want to tackle is from our conservative brother, Mike Psaki, okay? Because Mike Psaki made a statement I want to answer this way. He said, When run by government, the doctors and hospitals are captive of politicians and bureaucrats. To which I say, yes, thank you. That's what I want. Because they are currently captive by a shareholder and the executives who want them to minimize their care of our people for profit, to make money for a few, to transfer your wealth to them. If the politician and the bureaucrats don't do or don't serve us, if we are responsible American citizens, we can boot them out and put those who are responsible and sensible and careful into office. Unlike what we can do for a shareholder who is an abstract entity just telling the executives, make me as much money as I can. As it is, Mike Psaki, you are still suffering, my dear brother, from Stockholm syndromes, where the person who is enslaving you will you continue to support, and the persons that you have power over, you don't want to. You have power over the government. You have power over the bureaucrats. You have no power over a shareholder. You see what I'm saying? You see the warped thinking? And to a young lady who said, what about, Karen Webster, thank you for being here. Welcome aboard. She says, how about the people who are overweight? Should they have to pay more because they don't care of themselves? One of the things that Medicare for All solve is both what Mike Psaki speaks about, which is we want our doctors and all these people who are providing us care not to be captive to people who will kill you for profit, but we want it to be a humane social system, right? And therefore, my dear Karen Webster, I don't believe a fat person should pay more for health care. I don't think a person who smokes should pay more for health care. I don't think a person who drinks should pay more for health care. I don't smoke. I don't drink. I don't do drugs. And I have no problem paying taxes that will take care of the health of somebody who was addicted by the corporatocracy to cigarettes. I don't mind taking care of somebody who was addicted to the alcohol by the corporatocracy. I don't care taking care of people who were addicted by the drugs, the quaaludes, the amphetamines fed to them by the corporatocracy. I believe I am my brother's keeper. And as such, I don't want anybody penalized. I rather educate folks and tell them you will live a much better life if you try to control your weight. You would live a much better life if you attempt to not smoke. You will live a better life if you attempt to not drink as much. But as far as punitive actions and say you pay more if you smoke, I like sweets. Am I supposed to pay more because I'm at a larger extent or a larger risk of diabetes? I don't know. No. Medicare for All solves that problem. It treats us all as one big society. We don't have the corporations telling us what drugs we can take, what doctor we can see, what hospital. The system that we all support, the system that we all build is the one that does it. And this isn't difficult to understand. If you leave your ideological eyes or glasses off, it is quite easy. You know why? Because it suddenly empowers you. Too many of us are always ready to empower the corporatocracy because they make us believe that they are more worthy, that they know more than we do. When what they're doing, it's a big farce in that we are the ones who produce, we are the ones who innovate, we are the ones who create, and they are the parasites that live off of what we create, build, and provide to society. So I just wanted to get that out there beforehand. But I need to go ahead and say, please listen and consider getting our books. We discuss a lot of these things in my books. I'm Egberto Willies, as host of Politics Done Right, a progressive radio media show on Pacifica Network's KPFT 90.1 FM Houston that engages all ideologies. I found that our political angst isn't mostly ideological. There is a well-designed effort by many in power to control us. If we are at each other's throats, we are less likely to demand our economic and local wishes. In that light, I wrote 3 books. I wrote the first one titled, As I See It, Class Warfare, the Only Resort to Right-Wing Doom, to describe the entire economy in a manner we can all understand. It highlights why it was designed to pilfer most as it empowers a few, the chosen. The second book, titled, It's Worth It, How to Talk to Your Right-Wing Relatives, Friends, and Neighbors, take it to the next level. After understanding how the system pilfers, it is incumbent that we can speak to our peers to empower a change. The third book, How to Make America Utopia, Take Away the Economy from Those Who Rigged It, gives us a place to land. After learning about our economy that is dysfunctional for most and learning how to engage the other side, we point out what would make an economy that works for all. Each book stands on its own, but together they provide the full picture. Please consider getting one or more. You will undoubtedly learn, be entertained, and help us continue the mission with our blogs, articles, videos, and books. Brother Csack, in your comeback, I suggest you go back to my video and read that monologue that I just, or listen to that monologue that I just did, because it is diametrically opposed to what you're saying. Accept your power, Mr. Csack. Accept that you, along with the community, has power to demand of your government what is due you. All right, let's see what else we got here. Folks, para ver qué más tengo aquí. I tell you what, let's go ahead. You know, right now, I'm going to read all of these things a bit later. I can't take care of all of them. Oh, I didn't ask, did I? Please, folks, support the program. Go to politicsdoneright.com/books to get my books. Politics Done, whoops, let's see how I do that here. Maybe I can do it like that. Oops, that's the wrong one. Please go to politicsdoneright.com/books. politicsdoneright.com/books to get my book. If I can, maybe I'll just, there it is. politicsdoneright.com/books to get my books. Please go to politicsdoneright.com/patreon. Patreon is spelled Patreon. Patreon. politicsdoneright.com/Patreon. You can also support us on YouTube. politicsdoneright.com/YouTube. politicsdoneright.com/YouTube. But the best form of support, of course, is always PayPal. politicsdoneright.com/PayPal. politicsdoneright.com. Whoops, let's see. That's PayPal. You can either do it one time or however many times you want to do it to support this. Get me a coffee or two a month. That would be great. If I had 1,000 people doing that, we could actually get some help in here for. It's very, very difficult to do all these videos that I make sure that I have for you. Do all the interviews. I set them all up myself. When folks contact with something that's worth my audience. Remember, we get dozens of contacts every week as far as people wanting to present to our audience. And I select what I know is truthful, number one, and would be helpful to our folks, all of us here. So anyhow, and by the way, I'm going to start something, because there are times that some people ask for interviews and I'll be like, I don't know, I don't think so. But when I'm in doubt, what I'm going to start doing is put in a list of them and say, hey guys, should we talk to this person or not? But anyhow, I do all of that stuff alone. I need some help. So please consider supporting us. politicsdoneright.com/PayPal is the other way. Now there's a lot of new stuff at our store as well. politicsdoneright.com/store. politicsdoneright.com/store. Let me get it there. I think it'll. ¿Por qué no está funcionando bien esta tarde? There we go. politicsdoneright.com/store. And you can actually get an all-encompassing link to support us, which means you can, vámonos, para ver, no está perfecto esto, sácamelo ahí. All right, aquí. All right, politicsdoneright.com/support is the all-encompassing way. You can support us through our store, PayPal, Patreon, YouTube, Cash App, Zelle. What's the other one again? Venmo. We accept any form of support from our peeps because that's what we need. I have a little bit of time left and I want to play the last video. Everybody wants us to go to war. Apparently, I'm kidding, all right? Listen to this report. I want to play this and then we'll take it on the other side. Remember silly statements like, we fight them over there so we don't have to fight them over here? Remember how the New York Times was complicit in us going to war with Iraq by in effect being the stooge for the Bush administration. Remember all the times when we were asked if, do you think that's making us weak whenever we don't react in Bosnia-Herzegovina or in Sudan or in Yemen or whatever? The media, there is a sect in the media that always seems to attempt to push our government into war. I want you to check this out. We'll take it on the other side.
Just to put a finer point on some of the questions you've so far been asked, why shouldn't the images of the atrocities from Bucha compel a worldwide, unified, coalition kinetic response?
You mean a military war? Tell me more about what you mean.
Sure, a military response led by the United States and the international partners.
As in bringing military troops on the ground from the United States and NATO.
Well, the president has described outrageous things. You've called them atrocities. You've said perhaps we should brace ourselves for worse. Why not?
I think what the president's objective is and his responsibility is to make decisions that are in the interest of the United States and the national security of the United States and the American people. And that is not to go to war with Russia. It is to do everything in our power to hold them accountable, to support efforts through international systems to do exactly that, and to provide military assistance, security assistance, and support to the Ukrainian people and the Ukrainian government. That's exactly what we're doing. But it is not in our interests or in the interest of the American people for us to be in a war with Russia. Go ahead.
Now, what you see here is a reporter that is attempting to urge the United States to form some sort of a coalition to go into war. Does he realize what that really entails? I mean, a war trying to push out with a whole bunch of people going into Ukraine, trying to push out the Russians. They're going to look at that as, wait a minute, are they going to come and kick us out of Ukraine and use that as an excuse to take over our lands? Well, we better be prepared with starting with probably tactical nuclear weapons, and then who knows thereafter. If they come after our city, we're going to just go ahead and call it for dead. Launch an ICBM somewhere. The guy is a crazy man. If you believe that we can just go ahead and say, go in there and fight him directly as opposed to fight by proxy, you don't understand world politics. The truth of the matter is, Putin doesn't need to be taken out on the battlefield per se. Putin needs to be taken out by his people, his general, etc. And there's a good likelihood that exactly what the Americans are doing right now, what President Biden is doing right now, by a constant increase in sanctions and making the people pay in not with their lives, but in their struggles. Think about it. Russia has shown its violence by just by just killing people left and right, blowing things up left and right. He shows he has no heart, no humanity, etc. Now, do you think we can get anything by trying to go in there and kill his people as well to get out? It doesn't work that way. We try that, we're looking at World War III, and this is not half World War III. This is real World War III, because the Russian millions are going to feel under attack. We cannot allow the press to push us into war. And luckily, once again, Jen Psaki didn't have to turn and say, President Biden, what do I need to say here? She came out with an intelligent answer. We have to look out for what's in the best interest of the United States. We have to look out for what's in the best interest of the world. And just willy-nilly throwing a whole other several armies into Ukraine is nothing more than a declaration of World War III. I don't think that is what we want. In fact, I'm sure that is not what we want. Bridge MCP, let me tell you, you know my condition right now. I can't do live interviews per se because of how we are set up, and this is a temporary studio, etc. So I can't do live interviews. I used to do live interviews at in the studio. I found out that a lot of the people we interviewed, because of the times that we interview, they really like the remote stuff. But you are correct that we used to bring, and we will bring back at times, live interviews where you can actually interact with the person that we have on. I tell you what I probably will do though, because again, we have a telephone input and that sort of stuff. but to have it more dynamic with the person, generally an hour for interacting with the guests is not enough. So, we'll probably have those interviews on extended times, where we can have the interview and at the same time it can go on a bit further as long as the person we're interviewing is okay with it. But I love the engagement, and I like the idea that you just came up with, that we should in fact do more live interviews than we are currently doing right now. I can just tell you categorically, we probably will not start back doing live interviews until Netroots Nation. In other words, you will get live interviews from Netroots Nations because I will be broadcasting them. Every time I go to Netroots Nation and I'm on Radio Row, I broadcast the interviews on YouTube Live, Facebook Live, etc., etc., etc. So that'll be taken care of. Bree says, Egberto, maybe let us know before and we can submit questions. That's a very good point, Brige. Yeah, that's why I have the smartest listeners on the planet. Masticator says the Biden administration is setting themselves up for being able to avoid war and maintain a moral high ground. You cannot make Putin onto Hitler and then say you won't fight him and his evil. Masticator, there's actually some truth to what you just said, right? I mean, we can't say Putin is Hitler and behave the way we behaved with Hitler, right? That's a contention, and I understand it. And there's some morality to what you just said, dear Masticator, but here's a problem. Putin has nuclear weapons. If Putin didn't have nuclear weapons, NATO would say you're attacking a sovereign country and you're effecting crimes, war crimes on these people, and therefore we're acting. That's the reason we're acting. We can't act within the UN because Russia is on the Security Council with veto power, and the silly setup of the UN means one person on the Security Council with veto, and you can't function. It's one of the most ridiculous, inoperative setup you have on this planet if one of the perpetrators of evil happens to be one of the members of the Security Council. It makes no sense whatsoever, right? So, Masticator, there is a lot of truth in what you just said, but there is also some pragmatism that prevents us from starting World War III. Okay, and I think you understand it quite well. Let's see. Carl Cox says American democracy is being destroyed by conservative politicians and are working to destroy democracy in America. That's true. And let me just say that what conservatives have realized is that they don't have the numbers. And therefore, if you don't have I did a piece on this, if you don't have the numbers, what you have to do is controlled by the minority. In other words, how can you get minority control? There's only one institution in this country that is able to do that. Well, that's not true. There's a minority control is within our Senate, the way we elect senators, the way and also the way the Supreme Court is set up. It is set up that it has the ability to stymie the majority of people, even if it has nothing to do with the Bill of Rights. But that's for another subject. We're at the closing time right now, so I got to get out of here. If I didn't salute you, or if I didn't get to your message, let's see. Okay, if I didn't get to you, forgive me. But all of you know how to reach me. You can, and from those of you who have before, you know that I answer messages. Sometimes it takes me a while. I get several hundred messages a day. Anyhow, actually several thousand messages a day. My name is Egberto Willies. This is Politics Done Right. There you see, you guys bring more messages that I want to answer. Masticator say, you would not have a UN if not for the Security Council. Surely you agree the UN needs to go away. I'm starting to believe it, brother. I am starting to believe it. So, Masticator, I can't believe you. Listen, when you're willing to have civil conversation and talk intelligently, like all my listeners, including you, Masticator, you see what happens? When you decide not to be a nag, when you decide, I really want to be a part of the real discussion, you see where we get? What you just said there is absolutely true. I said the same thing today. What's the value in the UN with the Security Council if everybody has a veto that cannot be overridden? Right? How can 140 countries not override a veto of anybody on the Security Council? In other words, the rest of the world wants something, But because you're either America, Russia, China, France, Great Britain, and I don't remember what the other Security Council members, you can't do anything. My name is Egberto Willies. Bayou, Alistair, Bayou, Michael Rudman, Bayou, Bridge MCP, Masticator, Mike Cisak, Tom C, Carl Cox, E2247. Love you all. I didn't call all your names. Love you all. You guys have a wonderful day. My name is Egberto Willies. This is Politics Done Right. And you know how I end this, baby. I am what? Out! Welcome to Politics Done Right. I am your host, Egberto Willies. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at EGBERTOWILLIES. That is at Egberto Willies. Let us engage. It is Politics Done Right. Welcome to Politics Done Right. I am your host.